Hi friends, I am Virendra. In my advertising circles, where I head an advertising agency called Triton in Bombay, a lot of my clients and colleagues call me Viren. I also have a passion for acting, and in those circles, I am popularly known as Viru. You can call me by any name. Well, our today's subject of discussion is what everybody's been discussing about coronavirus. Today, we are really lucky to hear from an authentic and genuine immunologist, super specialist. Join me in welcoming Dr. Sitesh Roy, who has been a US board certified allergy and immunology MD super specialist, and he is here to shed light on this face off with coronavirus. So, Dr. Sitesh Roy, what is this coronavirus that everybody's been talking about?
Coronavirus is a zoonotic disease. Zoonotic diseases means that these viruses primarily infect animals or birds. There have been several known resources of these viruses in animals that have been known since the 1960s. From time to time, these coronaviruses mutate and they can then go from an animal or a bird infection to a human infection. This has been known to happen from pigs, from birds, from camels, and variety of different such sources. And when this mutation occurs and the infection occurs in humans, it then gets given different names. So in 2002-2003, we had something called SARS, Severe Acute Respiratory Syndrome. And then in 2012 and 13, we had something called MERS, Middle East Respiratory Syndrome. In each of these cases, there were civet cats or bats or camels involved in the transmission of these viruses to humans, it is believed.
COVID-19 is the name for a particular type of coronavirus.
That's exactly right. So it's like saying that I own a dog and then to say that I own a German Shepherd. So COVID-19 is the species of coronavirus that has now been very widely spreading from Wuhan, China, the wet markets where it originated, to a lot of different places in the world.
So, Dr. Roy, why is this spreading so rapidly? Because I remember when SARS happened, it started initially with a similar kind of noise, but then it immediately stopped after some time. So, why is this spreading so rapidly?
So what happens with any virus is that it has a certain amount of infectiousness or infectivity, and the infectivity of the COVID-19 virus, coronavirus, is very high. So what has been found is that when this began in the wet markets in Wuhan, from where people might have been having animal meat such as snake meat is the belief at this point of time, within a very short span of time, about 50 people were infected. And since then, the infection spread very rapidly to involve thousands of people within no time, all within the Wuhan and the surrounding 11 provinces.
Okay.
And so this kind of a high infectivity or infectiousness is something that is unique to COVID-19 infection. And that's what makes it so dangerous and so widely spread.
What are the symptoms of coronavirus? How does one recognize that he's got it? Because I've read that it starts with common flu symptoms, and so there's a lot of misunderstanding and complication in this. Can you just put a little more light on this?
So certainly there is confusion, and even as we learned about the disease as doctors, there was a lot of confusion. So people thought that originally it began like a common flu, influenza infection, where you would have a sore throat or a runny nose, and then you would have fever and then develop a cough, when in reality what has been found through what we would call case series and publications from China, which was the epicenter of this infection, is that fever and dry cough are the primary presenting symptoms, and less than 5% people present with sore throat or runny nose or nasal symptoms of any kind. And it's when this fever, and the fever is also not always present in all patients, it's initially present in 50 to 60% patients, but by the time the disease progresses, 90% patients have fever. And the dry cough then progresses to a pneumonia and breathlessness. So at that stage, it becomes very problematic where the patient is clearly requiring potentially hospitalization or further care. And in about 82% patients, it's found to be a mild to moderate infection. In about 14% people, it's found to be a severe infection that requires hospitalization. And in about 3 to 4%, it can actually require intensive care unit management, including intubation, mechanical ventilation, and other such treatments. And the fatality rate at this point is around 1 to 2, or some places 3%.
Which compared to SARS or MERS is very small or similar?
So SARS had a fatality rate of almost 10%. MERS had even higher, between 14 to 16%. And so compared to that, the fatality rate for COVID-19 coronavirus is lower, which is a good thing for us.
But the chances of spreading this disease is very high compared to them?
Absolutely is. So it has been found that there are something called super spreaders, where a single woman in a church in South Korea spread this disease to 50 plus people there. These kind of super spreaders were not seen in previous infections. Even in India, we have seen one person spreading it to 8 people. So this kind of a high infectiousness or a high contagiousness is something that is unique to COVID-19 coronavirus, which was not seen in SARS or MERS to the same extent.
So the spreadability is like compounding of
Absolutely
like a compound
is.
interest, how it helps you. So it's a similar compound factor applies here.
Very well said. So that is exactly how it is. One person giving it to 3 people, and then 3 people giving it to 9 people would be an example. It obviously doesn't follow any mathematics, but clearly that's how you would look at it.
So does this happen to anybody, everybody, or only certain kind of people it affects?
So that's a very important question. So people do wonder, am I at risk for it? So it has been found that there have been cases detected right from young children all the way to 90 plus year olds. So everyone can be a target for this virus. That's the first thing. The maximum number of cases that have been detected so far have been between the ages of 30 and 80. So people in that age range seem to be most infected by this.
Okay.
The fatalities have been highest in those above the age of 50. So much so that between the ages of 0 and 9, there have been no fatalities anywhere in the world. So clearly this virus tends to make the adults much more sick than it makes children or teenagers or young adults sick. That's one thing we know. And when we look at the reasons why a person may get it, having cardiovascular disease, heart diseases, having hypertension, having diabetes mellitus, having chronic obstructive pulmonary disease, what is called COPD for short, having other allergic or asthmatic disorders, and possibly having cancer and other what we would call immunosuppressive diseases puts a person at higher risk to be in that 14 or 15% of people who can get hospitalized or require intensive care treatment. So clearly there are subsets or subgroups of people who seem to be more prone to these infections. There is also some suggestion that smokers might get it more than people who are non-smokers because there's already airway inflammation in their lungs.
So what should one do if he feels that he's got the symptoms, or he figures that in his family somebody else is exhibiting these symptoms, or in his friend circle or office? What should one do?
So I think the most important thing is, as I said, identification of the case, because from whatever we know about this virus, identifying the case, isolating them, identifying their contacts, the people they have been in touch with or contact with, and isolating or quarantining them, those people, okay, and then treatment is really the key to us controlling this pandemic, which has spread now to over 90 countries and has affected over 100,000 people, and clearly has caused over 3,000 deaths around the world. So in this process, for anyone who feels that they have developed a fever and a dry cough, sometimes with or without breathlessness, they should seek medical care urgently. When they seek medical care, they need to know in their locality which are the centers that are able to diagnose the COVID-19 infection through something called a nasopharyngeal swab or a throat swab, on which a special test called a PCR test, a polymerase chain reaction to the RNA, the genetic material of the COVID-19 virus. This kind of a test has a turnaround of a few hours, so it's a pretty rapid test. And once the person is diagnosed, that person has a choice. If their symptoms are mild, they should self-quarantine themselves. And self-quarantine would mean that they stay in isolation. They even try to have minimal contact with their own family members at home. And they certainly don't go to work, school, or play, or any crowded places where they could spread it to other people. Now, if someone has been exposed to them, and whenever a case is identified as a sentinel case, we always try to find out where have they been, where could they have acquired this virus from.
Yeah.
So that also becomes very important when someone tests positive, to know where have they had foreign travel, have they been in contact with some people who have been abroad to high-risk areas like China, South Korea, Iran, Italy, where there have been very high number of cases that have been detected. And once that kind of a source and isolation has been done, then the contact tracking becomes very important. And the contacts of everyone who has tested positive should be kept in a quarantine, possibly even at their own home, for a minimum period of 14 days, because the incubation period of this virus on an average is 2 to 5 days, but can be as long as 14 to 24 days. And so for that period of time, the person needs to be observed and monitored. And if this kind of containment is done, then we can have the best chance of avoiding the spread of this virus to too many people. So there is a lot of what I would call personal responsibility, and then responsibility towards your family, your society, your co-workers, that people have to have at a very high level to prevent a very rapid spread of this around the globe like it's happening.
Actually, that was my next question, doctor. What if somebody understands that he's got these symptoms, but then out of fear or out of being tabooed or labeled as something, he does not tell people about it? What's the risk that he's carrying for himself and the risk that he's carrying for the other people around him?
Certainly. So I think there are several things to understand. There is obviously a panic associated with this infection, and I would strongly recommend people not to panic, because as I mentioned earlier, up to 97 or 98% people will eventually recover from this infection. Though what may start off as a mild infection can become very severe within a span of a few days. And hence, it becomes very important that a person seeks medical care at the earliest possible moment when they feel that their profile of symptoms is something that might indicate this infection. And even if it is not, then their family physician or their super specialist in respiratory or immunology diseases would be able to tell them that this is not a COVID-19 infection, this is a common cold like a rhinovirus, this is a normal influenza, a flu infection, or any of the other viruses that also circulate at this time of the year in our community. The other personal responsibility is that if you hide this infection, you could potentially spread it to your loved ones, your family members, your co-workers, and then end up with a much bigger problem, which will become a conundrum for you as to why you did not take care of this earlier. So it is really an urge, both from governmental agencies, from the World Health Organization, and from us as the medical community, that certainly if you feel you have symptoms that could match with a COVID-19 coronavirus infection, you should get evaluated, you should get treated, you should get quarantined and observed, especially if you have the risk factors, because most people who have this infection actually don't have it. It is something else that they have.
Yeah. So how is this infection being treated? What are the methods that the medical science is using to treat them?
So far we don't have a medicine that can treat the coronavirus COVID-19 infection. There have been trials in different places where there has been a large number of cases, such as in China or Italy or Iran or South Korea, where they have tried anti-malarial medication called chloroquine. They have also tried certain anti-HIV medications for treatment, and they've also used certain antiviral medications that are used for influenza called oseltamivir. Has been tried in these patients, but largely the treatment for COVID-19 infections is through the supportive care, which means for the fever there would be antipyretic medications that would be given. For the respiratory difficulty that is there, oxygen might be required. If someone really progresses in terms of the infection, then they might need mechanical ventilation or supportive care, intravenous fluids and hydration, which is something that people can do at home also. So at home, a person would largely take anti-fever medications, hydrate themselves, take rest, eat a light meal and take care of themselves. And many a times this is all they need to do during their self-quarantine to get well from it. There are certain medications that are being looked at and aggressively tested, but for any medication to come out into the market with proper approvals, there's a minimum turnaround time of 3 to 4 months, if not 6 months.
That's what I wanted to ask you, doctor, since you're in touch with a lot of doctors internationally across the world and also in touch with a lot of pharma companies across the world. I wanted to know if you have any sense of how soon are we expecting a treatment for this, or where is the progress happening on this?
So I think that the medications that are being studied, the shortest timeline that is being looked at, I already mentioned, is 3 to 4 months, not before that, because there are usually animal trials. So there are some researchers who have said that they found a very interesting target to treat bird flu from coronavirus. And when they start doing the human trials, there's always a phase in which you first test it to know what doses are safe. After you know the safety, then you look at efficacy. Does it really work in humans like it did in animals? And after you've done that, there are dosing studies to know what is the optimal dose for a human being. So all of this minimum 3 to 6 months.
Okay.
And if you talk of a vaccine also, which people have been saying there's already a coronavirus vaccine, there is no vaccine at this point of time. Vaccines also will take longer, probably close to 6 months or a year to come into the general domain for people to use and doctors to give it to their patients.
In line with the same questioning, I've also been hearing a lot of myths about this can be cured by giving zinc or can be cured by eating more garlic, and various such sort of myths and things floating around. Would you like to shed some light for our viewers on that? What is the truth behind all this?
Certainly. So I think that one of the earliest myths that I heard was boiling and concentrating garlic juice and drinking it, and that would prevent coronavirus infection. Now, garlic has been known to be antimicrobial since thousands of years in many different cultures, including in India and other parts of the world. But there is no data to suggest that that can actually prevent a coronavirus COVID-19 infection. The next thing that I was hearing a lot about through our social media was drinking warm water or hot water, and drinking it at every 15 minutes interval. Again, while it's a great idea to keep yourself hydrated, because when you're well hydrated, you don't easily get sick and your immunity works well, I don't think that this alone can solve the problem of COVID-19 infections. But certainly in areas of the world where it's very cold, instead of drinking cold water, drinking warm water can be very beneficial for people. Similarly, you asked about zinc or vitamin C. These have been known for a very long time to be immune supportive. I wouldn't call them immune stimulant, but immune supportive. And certainly these, what we would call supplements, might benefit some people. But someone who has a normal healthy diet and does not require extra zinc or vitamin C and is having enough of their citrus fruits and having fresh vegetables and all those things, in those people these kind of interventions may not make a very big difference really for their health. But for people who don't, in such cases taking multivitamins with zinc and selenium, taking vitamin C in a reasonable dose, some people go overboard thinking that too much of something is very good. That also can cause problems because these are not natural medicines and they can cause potentially issues, gastric issues mostly, digestive issues in some people. So I think that that's what I would have to say with regards to these different myths to the viewers. If there are any other specific myths you've heard about, I'll be happy to address them also.
Recently I was watching on TV about homeopathy having a solution for this, and I guess that also must be about giving immunity builders or immunity stimulants or immunity supporting medicine. Is that what it is?
True. So in homeopathic medicine, in Ayurveda, in Unani medicine, what the modern medicine calls alternative medicine, there are a variety of different substances or formulae that have been used as immune stimulants, and these are being now purported as being ways to prevent coronavirus. Again, there are no tested research protocols or trials that have been done on these therapies. They may have some benefit in certain people, but certainly these are not things that can be recommended for the public at large to do. And so I think that is where really seeing a super specialist in the field of immunology, allergy, respiratory diseases becomes very worthwhile for a person to know what exactly it is that they should be doing in their individual case.
So going to an immunologist for something like that is something that you think is the right thing to do, because mainly the chain is a person goes to he tries something at home, then he goes to his general practitioner, and then do you think this whole chain could also waste a lot of time in this process of identifying and curing himself, or then therefore he should directly go to an immunologist or any specific kind of a doctor that he should approach for something like that? What should he do?
So I think it makes sense. In a normal day-to-day life, a person getting a fever and a cough would go to their family practitioner or their general physician or to an MD physician. And if these physicians are well informed about the COVID-19 infection, then they might be able to give specific diagnostic and therapeutic care. But in most cases, what we are finding is patients are being turned back with just a fever medicine, or sometimes an antibiotic, which is totally useless in the COVID-19 infection unless someone is bacterially super infected or co-infected. And they are told to do general care, which delays the diagnosis and the treatment. So going to a super specialist in immunology and respiratory diseases, or a super specialist in allergy who really is tuned in with what the COVID-19 infection is and what it does to a human being, may save time, may reduce the delay in diagnosis and also in isolation, quarantine, contact detection and treatment. And certainly as an immunologist myself, I offer to my patients and their families ways in which they can keep their immune system boosted. And that those immune boosting therapies can also make a very big difference in preventing one, the infection from happening, and second, the infection from spreading if someone were to acquire it.
Okay. Also, another important thing is that, there are two contradictory points of view on masks. I've been hearing people saying that don't wear mask until you're infected. But when I talk to people, they say if I wear a mask, there are chances that I might not get infected. So what should one do? And I think there's a lot of confusion in viewers on this question. Can you shed some light on that too, please?
So masks and coronavirus, this is a very hot topic, and there's a lot of mass buying and selling of masks going on. So it would be very interesting for people to hear what I will just say. The first thing is, if a person is infected and they have the COVID-19 infection or they are under evaluation for the COVID-19 infection, they absolutely need to wear a mask. And the minimum of what they should wear is something called a 3-ply mask. This 3-ply mask used correctly, because many people do not know how to use the mask correctly. They wear it the other way around, or they wear it upside down, and then it doesn't work as well as it should, is very important, and we will demonstrate how it has to be used. But the patient wearing it is very important, and if the patient is living with other people in their family or going anywhere, then it becomes even more important to wear the mask. Now, should the general public wear it? This is a million-dollar question in some ways. There are some agencies that would say it's not required. I am, however, of the opinion that if you are going to be in crowded places, or you are going to be traveling by air especially, and you're going to be exposed to international crowds and international places, then wearing a mask for your own protection is also worthwhile. And a simple 3-ply mask, it does not need to be an N95 mask, is enough to do that, because the coronavirus is a large virus, about 400 to 500 nanometers in size. And a typical medical face mask can be enough to prevent its spread. Now, those who are in the field of medical care, doctors, nurses, technicians, supportive respiratory therapists and others, it's strongly recommended that they wear an N95 mask for their protection, because that has a much greater chance, and many of these masks have to be properly fitted for right use. So using that can make a big difference. The other thing to remember is masks need to be discarded after a certain period of time. So if you have coughed or sneezed into your mask, you should not use it for more than a day.
Okay.
Sometimes you might be able to use it for a day or two. Again, if you've been in crowded places and amongst a lot of people, then you have to discard the mask. So people are trying to use the same mask for a prolonged period of time, then it loses the purpose of why you're using the mask. So the mask certainly for preventing spread. Secondly, for protecting yourself from the virus, and then for healthcare professionals who are exposed to a lot of people that they are evaluating and treating for respiratory infections, there are right ways and wrong ways to do that that I've just highlighted. And as an example for what this mask would look like, so in any mask there's an upper section where there is a band which needs to be on the top side, because if you just put on the mask, it's not going to fit very well on you. Whereas if you do this, and it's generally got a metal band inside it, and you also do this so that it spreads and covers the whole face, that's when you would get the maximum protection from the mask. Now, there are people who wear it, as I said, upside down. They may wear it this way. They may wear it inside out. Some people believe that if you're trying to prevent spreading the infection, then the lighter side of the mask should be inside and the dark outside. And if you're trying to prevent it getting it from others, then the light side should be outside and the dark side should be inside. You would really need to know what mask you're using and what its characteristics are in order to do that. So I think that the whole topic of masks and coronavirus is very interesting and certainly needs to be looked at carefully.
I think we can do a separate segment on that where we explain to people. In fact, when I was on a flight a few days ago, and it's really very important to understand how to wear this, because I saw an elderly man, in fact, wearing a mask covering only his mouth and not his nose. I mean, I was surprised how could one do something like that. But various people have their own thinking of how to use it. So it's important we should do another segment on this where we cover this in detail with maybe diagrams or something of that sort. So now my next question to you was, a lot of people have to travel on work internationally, domestically. So what is your advice to them? How can they take care of themselves? Should they, shouldn't they? These are all questions going on in people's minds. Some people, and since this is the time of April, May, June coming up, a lot of people would have booked their summer vacations. What is your advice to them?
So I think in this, there are level 1, level 2, level 3 and level 4 advisories that our viewers need to know. A level 1 advisory is where you're traveling and you're going from a low risk area to a no risk area, where you would just take your normal hygienic precautions. In a level 2, you're going from a low risk area to an area where there may be some cases, and there you would need to take extra precautions such as hand washing frequently for at least 20 seconds with soap and water, or using a proper preferably herbal based hand sanitizers that I recommend to people so that they don't cause any irritation to the skin of many people who are sensitive to it, and also using masks when required while traveling. With a level 3 advisory, you're going into a potentially high risk zone but not necessarily an epidemic area, and in these areas you really want to travel only if it's required. So if someone would be wanting to go to any part of the world where there have been more than a couple of hundred cases right now, it would be a good idea to choose whether you really should be traveling for whatever you're doing right now. Okay. And then a level 4 advisory would be for someone going to Wuhan, China, which is basically don't go, okay, or to Iran, or to South Korea, or to Italy, where the cases are rising very rapidly, and there the clear answer is don't go. No matter how important it is, your life matters more. Let the epidemic settle down, let the cases reduce, and only then travel. So this would be my advice to people who are thinking of traveling with the right kind of precautions to low risk and low danger areas. So within India, if someone is traveling and it's not to any high risk areas, then they can certainly still do that with precaution.
Okay. So Dr. Roy, what are the lessons that we have to learn from SARS, MERS and now COVID-19?
I think there are several things that have become very obvious to us over the years. If we take that in every decade we have had one outbreak, clearly Mother Nature is trying to give us some message. This can be interpreted in several ways depending on what philosophy you look at it from. Clearly we are not taking care of ourselves and our environment very well. All the pressures that are there on us, whether it is with animal farming, whether it is with the type of diet that people have, whether it's with the type of stressors that we are living in, our immunity is not at its optimal, and so is it not amongst animals from where these mutations can occur and transmit. So I think one of the key messages here is to stay away from exotic foods, exotic meats, exotic animals, because as I said, whether it is transmitted through camels, whether it's transmitted through bats, whether it's transmitted through snakes, these don't necessarily need to be the primary foods that we eat in a time of our lives and in a culture where we have so many other options of foods that are safer. That and taking care of our own immune system and keeping it at optimal so that under stress we do not get infected, and once infected get a massive abnormal response, what is called a cytokine storm, where a lot of inflammatory mediators are released and our body goes into various types of organ failure. Also recognizing that if we have hypertension, heart disease, diabetes, we have attracted chronic diseases to ourselves which make us more prone. So the ultimate question comes down to what are we doing in our environment and in our lives that is making us prone to these kind of infections. So I think that those are the lessons that people really need to delve into in their own lives and as a community and as a group, and address it so that we are healthier and our immune systems are healthier and our environment is healthier. Even the degree of pollution that we are living in might have a role in all of this.
Doctor, it finally boils down to immunity as far as I understand. So what should one do to build his immunity and make it stronger and stronger?
So in this, I would say that individuals who eat a healthy diet, a timely diet, individuals who are having more of fresh green vegetables, fruits, what would be called an antioxidant diet, okay, nuts, things like that, tend to have healthier immune systems. Also, avoiding a very sedentary lifestyle, so having physical exercise and activity in your daily routine. Getting exposed to sunlight, we've all heard about vitamin D and its importance with regards to the immune system. Keeping yourself well hydrated, getting adequate sleep, these are the common advice given by any good physician to their patients for prevention. But beyond that, I would say that as an immunologist, there are certain special dietary recommendations that I give to my patients on a one-on-one basis when I evaluate them as an individual and also as a family, knowing their cultural background, their likes, their dislikes, their preferences, so that they can have foods and a diet and a lifestyle that is more appropriate to keep their immunity strong. Also, There are certain vaccines that I offer to my patients in my practices so that they can from time to time keep themselves protected from what we already know and have protection for. Most people would go to a general physician or to their family physician to get advice, which is symptomatic care and advice. If they see an immunology super specialist, then they are able to get very specific advice that is customized to their immune system and body type. So assessing their immune system, knowing whether it is healthy, not healthy, these are things that can be done for a person to reduce their risk, and certainly and obviously taking care of their chronic illnesses and diseases in the best way possible so that they don't become a target for new viruses like this.
Yeah. Also, doctor, coming back to the specific issue of coronavirus, a lot of people have pets at home. So is that a cause of worry? Can anything be transferred from the pet to them?
The answer is no at this point of time. So domesticated pets like cats, dogs, birds have so far not been known to be a reservoir of coronavirus. Interestingly, there has been a case in South Korea where an infected human being gave the coronavirus infection, COVID-19, to their pet dog. But interestingly, the dog has very low viral titers and does not seem to be at risk of transmitting it to anyone else so far. But this clearly shows that we could be more harmful to our pets than our pets are to us. And so at this point of time, there is no concern, but certainly after interacting with pets, people of all ages should wash their hands, wash their faces with the right kind of antimicrobial, antibacterial hand washes, face washes, and take a reasonable precaution that we would say, especially with animals that they are not their own.
And what about, does one need to give up eating non-vegetarian food?
Again, a very burning question, and a lot of people are being told that give up seafood, give up chicken, give up other types of meat. I think this is very much a personal decision that a person takes. In general, vegetarian diets have been shown to be anti-inflammatory, which is a very positive thing. And so if during a time when a lot of inflammation is going on in people's bodies due to a variety of reasons, and this virus can trigger heavy amount of inflammation in the body because it is so new to the human beings, not having non-vegetarian food can certainly have its benefits. Now, long term, what needs to be done is something that an individual has to decide for themselves. There has been no evidence of so far, at least in India, of any of the animal markets being a source of infection, but it may only be a matter of time before a human being who may have contracted the infection may go into one of these markets, and then everything there becomes a source of transmission, especially if there are live animals and birds in that market. So my general advice would be try to eat as much of fresh, healthy greens, vegetables, fruits, juices, nuts, things like that, which have zero risk of transmission, as we would say.
Yeah. This virus is not really in India, except for a few cases that we've heard and read about, and it primarily started from China and it's largely affected China. So is there really a reason for us to worry about?
Again, a very pertinent question. I think people in Iran, people in Italy, and people in South Korea thought the same maybe a month and a half ago.
Too far away from China.
Correct. That they're very far away from China, and what risk do they have? This is a pandemic by all proportions. It has spread to over 90 countries, 6 continents. Antarctica is the only one that it's not there at this point of time. There are now faster cases occurring outside China than occurring in China. So I think every country needs to be on a high alert. And I would say that Indians definitely need to take all the precautions that they can with regards to whatever we have discussed in today's interview and chat. And we should not take this lightly. We should certainly not take this lightly, because it's just a matter of time. Like, there have been tourists who have come in who were perfectly healthy. They were screened at the airports or at the seaports, and were perfectly healthy and then demonstrated symptoms after they came out of their incubation period.
Yeah.
And one person going into a market, going into a school, going into a public place, going into a public event or gathering can then become a source for so many more people. And we live in a country of 1.3 billion people. So we certainly have a lot at stake. And I would say that we certainly need to be concerned about this and take all the right steps, whether it's the governmental agencies with their emergency preparedness, whether it is doctors and physicians with their updated knowledge and management skills, and whether it is individuals and their families and society with regards to what they need to do in terms of precautions so that they don't, one, get this infection, and if they get it, what do they do after they have it?
So Dr. Roy, you have so many patients, and so how are you helping them boost their immunity and stay away from this virus?
So most of my patients who have been in contact with me for more than several visits know that they have almost nothing to worry about with this COVID-19 coronavirus infection, because we have in our practices extensively discussed with them about what kind of a diet they should be having through our diet counselors, what kind of a personalized diet they should be having based on their body type. I give vaccines to all my patients for the seasonal risks that are carried in India. And also I have a series of immune boosting therapies that I provide to my patients. My diet counselors also provide something called an immune detox diet, and this immune detox diet is invaluable at such times to keep a person's immunity at its sharpest and best. So literally my patients, when they come in, they seem a lot more calm and peaceful compared to the general population, because they have been seeing us and getting this very specific, what I would call customized, unique guidance for keeping their immunity at the best, for keeping their allergies and their asthma under control, which are known risk factors for respiratory infections. Yeah. For getting their allergy testing done, because 20% of the population today has some form of allergy or the other, and if these have been identified, diagnosed, avoided and treated, a person is at much risk of having any inflammation in their respiratory tract, which would then become a quick source for the virus to attach to and cause an infection. So there are many things that we are doing, and I think my patients are sleeping very peacefully at night.
That's great to hear, doctor. What is your focus when preventing this viral infection?
There are several targets that we recommend people to focus on, general targets which have been very widely expanded in social media. The first one is hand washing. Frequent hand washing, especially if you have been in public places, you've been touching surfaces that are not your own, you've been in trains, buses, cars, crowded areas, public buildings, workplaces. You have to wash your hands with soap and water, soap at least for 20 seconds. And if you don't have access to that, then using a proper alcohol-based sanitizer, preferably a herbal hand sanitizer, alcohol-based, would reduce your risk of transmission. The second is not touching your face, your eyes, your nose, your mouth frequently. And if you're going to do that, your hand should be washed or sanitized before you do that. Because if you have touched, so contact transmission, if you have touched any of the surfaces where someone has sneezed, coughed, or the virus is still active, because it can be active outside the human body for several hours, then you need to wash your hands, sanitize your hands before you touch your face. The next is, if you have a cold or a viral infection and you're sneezing and coughing, the right way to do that is you either cough into your elbow or into your shoulder, and try not to spread it widely, because up to a 3 to 6 meter area you can spread the virus if you're coughing and sneezing.
So that's really large.
That's pretty large. And so, and if you're around people who are sick and are sneezing or coughing, the usual recommendation is try to exit that area. Try telling that to a doctor who's seeing patients every day. It's not possible. So if you're in those scenarios, then using the 3-ply mask or using the N95 mask, depending on who it is your safety net for preventing the transmission. The next thing that's very relevant is actually is sanitizing the surfaces, whether it is doorknobs, handles, commonly used areas that many people touch and get exposed to. Cleaning that with the right kind of alcohol-based cleaners or bleach or chlorine-based cleaners can be very, very valuable to prevent the spread. And certainly now in China, where the cases have declined, they are taking on extensive sanitization procedures in many, many public places, areas, schools, colleges. They are even sanitizing their currency notes before they put it back in circulation, because you just never know where this could be transmitted from. So with these precautions, I think people can certainly, and the last and the most important precaution, if someone does get diagnosed or is under quarantine, not coming in contact with people, I think that's a very, very important way to prevent the spread, and what we call isolate the cases and delay the transmission.
You know, when I think of it, our Indian ways of doing so many things was so scientifically and well thought of, including the way we greet our people with folded hands. Unlike going and shaking hands with people where there is so much of risk of transferring many viruses, etc., to each other. I mean, it's really fabulous, and you know, I think something like that could be another thing that we could apply in our actual lives, where we start greeting people with folded hands and reduce the risk of touching each other and spreading something like that.
It's very interesting that you say that, because there are certain recommendations now even being made in public where instead of a handshake they're recommending a namaste, or they're recommending a fist bump, or they're recommending an elbow bump, and there are funny things going on in social media where they're doing an ankle shake. There's a lot of different stuff, but the simple thing that I would say that, you know, in certain cultures a handshake is considered a way of informally, formally greeting and meeting, and in those situations having a proper herbal alcohol-based sanitizer is the key, okay? Where if you do have to do that, you quickly sanitize your hands or go and wash your hands. And remember not to touch your face till you have done that. So I think that the truth somewhere lies in between all of this. And but yes, there are many, many cultural features in Indian culture where a vegetarian diet is preferred, where a namaste is preferred to a handshake, where we have more of a natural based diet, all of these things which are very beneficial for people, and certainly our temperatures in our country, okay, because it's been shown that the COVID-19 virus does not do well once it warms up, and we are right on the brink of ending our winter and going into summer. And I think that will also help with reducing the transmission.
We're really lucky in that sense.
We are certainly lucky in that sense, and I wish the best for the areas in the world where the cases are increasing. But in the next couple of months, as the temperatures warm up and they go above 25-26 degrees Celsius or above 70-72 degree Fahrenheit, the transmission will reduce, the survival of the virus outside the human body will reduce, and as we had seen with SARS and MERS, the number of cases declining by the months of May and June is something I really look forward to all those people in the world.
One last question, Dr. Roy, is you know, there is a myth that this started with having bat soup. I mean, on a lighter note, what do you have to say about that?
So there is no data at this point of time to really suggest that this began with bat soup. We certainly know that it started from an exotic animal market where there was snake meat being sold, bats being sold, many other type of exotic animals being sold. So as I mentioned earlier during our interview, I would suggest to stay away from these, and China had a shutdown on all these markets, which can tell you how important that step was. Funnily, people have also said that coronavirus has something to do with Corona beer. That also is not true. There are many such funny myths going around, and we certainly don't need to get into them or believe them. I don't think it's necessary.
So thank you, Dr. Roy, for this enlightening information. I'm sure our viewers will be really benefited with what you've shared, and I hope you can bring all this into your lives and live healthier and happier. To know more, you should subscribe to Dr. Roy's YouTube channel, Dr. Roy Health Solutions. You can also contact him on his website, or his email ID, which is given here. Stay healthy, be informed, and be happy. Stay tuned in for more. We have a lot more videos coming up for you. There are already a lot of them on the YouTube channel, not only to do with coronavirus, but with a lot of issues and questions that we all have. So be there. See ya.
Thank you.